My name is Oscar Ochoa. I'm a physician. I'm a plastics and reconstructive surgeon in San Antonio, Texas with PRMA, which stands for Plastics, Reconstructive and Microsurgical Associates. I've been with PRMA since August of 2011. I've lived in San Antonio from 2001 to 2009, completing my general surgery residency at University Hospital at the University of Texas Health Science Center in San Antonio. In 2009, I moved to Houston and completed my plastic surgery training at the University of Texas, Houston, specializing in reconstructive surgery. Since then, I moved back to San Antonio to join the current practice. One of my personal strengths is being a native of South Texas and living and growing up in a bilingual home. I'm able to speak Spanish with patients that come from other parts of the state, particularly South Texas and even Mexico, and talk to them in their native language regarding breast cancer reconstruction. Most of these procedures that we perform here in San Antonio are not offered in Mexico. Therefore, patients require a little bit more education about the procedure, the potential complications and such. Doing that in their native language, it makes things a lot easier for them to understand. A bond is typically developed much better with the patient when they feel as if you understand where they're coming from and are able to communicate with them much easier. PRMA is a group that specializes in plastic surgery, in plastics and reconstructive surgery of the breast specifically. It's a comprehensive group where we see the patients usually before cancer surgery is performed. We speak to them and counsel them regarding their breast cancer reconstruction options, and we offer all different sorts of highly specialized breast reconstruction, anywhere from using tissue expanders and implants to the most complicated and technically challenging procedures, which would be to move tissue from one area of the body to another to reconstruct the breast. It's actually a very eye-opening statistic that only approximately 30% of women that undergo breast cancer surgery are counseled regarding the possibility of breast cancer reconstruction. But we believe that every woman should have the right to at least be counseled regarding the possibility of breast reconstruction. A flap procedure is the term that we use to describe a procedure where a certain portion of the tissue from elsewhere in the body is moved to the breast, or to the chest I should say, to reconstruct the breast. Usually that requires the reconstructive surgeon to dissect blood vessels that are providing blood flow to the tissue, as well as drainage from the tissue back to the body, and reconnect them to blood vessels that are already present in the chest. Those types of procedures are much more complicated than tissue expanders and implants. They require a lot more technical know-how. They require also the infrastructure that should be in place to not only perform the surgery in the operating room, but also monitor the patient afterwards. But we feel that initial complexity of the case is offset by more stable and better long-term results from an aesthetic standpoint, as well as from a complication standpoint. Breast cancer reconstruction is not something that has a limit to. It can be done immediately after a breast cancer surgery, or it can be done even years later. So thank you very much to all the people that have watched this video. Thank you so much for taking time out of your busy schedule to watch the video. I hope I was able to provide some information where things can become a little bit clearer. We understand at PRMA that breast cancer is a life-altering issue. We believe that every woman should have the right to hear about breast reconstruction, and if that's a possibility that is consistent with what you want, we are more than willing to talk to you about it. Please contact us if you have any questions. We have a very active Facebook page where lots of patients from all over the country post their questions. We're very quick to respond. Feel free to contact us. It's free of charge. Oftentimes, a lot of the physicians here at PRMA are answering those questions directly, so it's very easy way to get professional opinion regarding breast cancer as well as breast cancer reconstruction issues.